My name is Dr. Carrie August, and I have worked as a pathologist for over 30 years. I have been the doctor who diagnoses breast cancer from microscope slides, gives important information about your tumor, and answers questions such as, was it removed with adequate margins? Is there tumor in the lymph nodes? And is your tumor positive for markers, ER and HER2? During my career, I have also seen the many changes and all of the progress we've made in treating breast cancer. Sometimes all of the changes can lead to a lot of questions, and I'm here today to answer some frequently asked ones. Now we have a question about something very complicated. On my original biopsy, I was HER2 equivocal, strong 2+. Upon FISH, I was found to be HER2 negative. I would love to hear the opinion on this of an actual pathologist as opposed to the medical oncologist who is just reading the report. I sympathize with you. HER2 is such an important test that your pathologist interprets, and our understanding of it is still evolving. So, as your pathologists, we work very hard to know the newest information. In most cases, we start with the IHC test. If it is 0 or negative, we can be sure the patient is HER2 negative. If it is 3+, it's positive, and we can be sure that patient is 3+ positive. If it's 2+, we call it equivocal, and that is when we do the FISH test. The FISH test is very specialized, and sometimes it is performed at a specialized lab, which is why it can take longer to get your result. The FISH result from an equivocal 2+ IHC preliminary test is the most precise way to tell if the tumor is HER2 positive or HER2 negative. And we used to think that an IHC score of 1+ was plain old negative, but now we know that for some women, it may have some significance for their treatment. So we adjust our testing and scoring guidelines as we learn more about how our patients do long-term with HER2-directed therapy. Thank you so much for taking the time to watch this. I hope it answered some of your questions, and you can find more answers to questions about your pathology report at yourpathologist.org.